And thank you for bringing me. It's a pleasure being here, and it's a pleasure meeting you all, and I get a lot of new ideas, and the people on the field needs a lot of research to look upon and get some more influences from, because on the field it's hard. There are many difficult crimes. There are a lot of people suffering, and there are a few of us that really want to specialize and work with these people. I was alone in Scandinavia as a clinician working for 6 years in the whole of Scandinavia, specialized on hate crimes against LGBTQ people, which meant I had people from Norway, Denmark, Finland, and everywhere in Scandinavia coming all the way to Stockholm to get help. Why? Why do you go all the way to Stockholm to find specialized help? Why don't you just go to your closest psychiatrist or whatever? Which is one of the signs why we need specialized units, or the other way, getting all the surrounding helping systems work. They don't work, not yet. How does a victim conceive that he or she, or if it's a transgendered person, but the person has been a victim of a hate crime? When we talk about hate crimes in media, when we talk about hate crimes in the common words of society, crucial. Thank you, Jen.
Sorry, just some administration about it.
Yeah, that's all right. That's all right. The victims come to me or to us working with the field, and they don't know if it's a hate crime they're suffering from, because there are a lot outside telling them that it's not a hate crime, because they have not been physically abused, perhaps. They have not been a subject of murder. This is not a hate crime. I've been abused, I've been suffering, but it's not a hate crime. And sometimes that is that level we have to bring our patients or clients into. Understand that you are not the problem. The problem is outside of yourself. It's you are not the problem. And it's very hard to make people feel that. Because if we look upon the ordinary life hate crimes, I call them, it's all about everything else but murders. It's about the neighbor. It's about the schoolmate. It's about the family. And like one client said, imagine risking your life just because you have the wrong eye color. Just that. If people believe that being gay is about choice, then they have gotten it all wrong. I'm in love with a woman, just that. She's 18 years of age. She comes to me and she tells me all this, and I have to ask her again. The first sentence you said, risking your life, is that why you're here with me? And she says, yeah. My family is ready to kill me, and they are waiting for me at home. And I asked her, did you tell them that you're gay? No, they found out. A cousin who drives a cab in the town saw me and my girlfriend walking into a club. He reported back to my family and told them that I was in a gay club. I can't go back home. I can't go back home. And I asked her, do you want to make a police report? And she said, you know what, Anneli? I can't make a report. It's my whole family. Who am I going to report? Could we help her? Of course we could help her. Hiding people that are LGBT people, or also queer people, it's a matter of fact for, I would say in the US, talking to Community Against Violence, they began in the 70s or the 60s to hide people not being able to go back to their families. I would like you to bring down hate crimes to a much closer range than the other one, the unknown one. Because a lot of us suffer from crimes where we know the perpetrator, somehow know the perpetrator. My friend and colleague, Professor Eva Tiby from Stockholm University, she would have wished to be here, but she couldn't. And she has looked upon in Sweden what the perpetrator looked. What are they? Who are they? And when she looked at the gay men, she could see clearly that they were between 15 and 25. There were usually more than one of them, 2 or 3 or 4 or 5 gangs. And 3/4 of them were attacked by unknown perpetrators. They didn't know them. Okay? And this is what a lot of the minority think is a hate crime, when these standards are included. But if we just turn a little bit and look upon my group, lesbian and bisexual women, who are our offenders? Our offenders are older, grown-ups, 30, 40, 50, 60. It's one perpetrator, usually. And it's a known perpetrator. It's our neighbor, it's our brother, it's our mom, it's somebody we know. It's not to generalize too much, but there are different pictures. And if I would bring in all the categories, the queer group, the transgender group, you would see even more pictures of a profile of the perpetrator. And that makes everything confusing, especially for the victim. Who am I? I knew him, and he's a guy I've known for 5 years, and he's 60. He's not committing hate crimes, it's something else. But if we bring back statistics to the police, you would see something, again, totally different from what the group is really suffering from. You will see the police tells us that the suspects are 80% men doing hate crimes. They also tell us that they are very young. And you can make a conclusion from this. Which are the ones being reported to the police? What crimes are being reported? Not the ones in our ordinary life. These are the ones. And in Sweden, we think about, or research show, that 30% of those who are victims of hate crimes, they report to the police, about 30%. Is that a little or is that a lot if you compare to other groups in society? Actually, there are other groups that don't report as much as 30% even. So don't feel sorry, it's just a fact. But about 1/3 is reporting. And the ones reporting, they have suffered from the most severe and hideous crimes, of course. Then again, we turn to the group and we ask them, whom would you turn to for help? And look at this. Where is the police? On the 4th place. It's not on the top at all. But what is surprisingly is that the healthcare system is on 5th place.
What does it mean to?
Turn to?
What's RFSL?
RFSL, that's the National Federation for Gay and Lesbian Rights and Transgender Rights in Sweden, sorry. So that helpline is on 2nd place. And I think it will be the same in the US. I don't know if you're going to show some of that. Yeah. You go to where you are safe the first. I was in court last week, and the victim was asked by the judge, why did you call your boyfriend instead of calling the police immediately? I thought it was a stupid question, really stupid question. Who do you turn to first of all? people that you're safe with. They can go with you, come with you, go to the police, perhaps, or not. And others in the network, it could be that you're a member of a LGBT group where they have support groups and so on. Perhaps you go there first. That makes the law and the police work and lawyers and prosecutors, they are not at all the ones first in place when I meet my victims, not at all. And I think together with the other ones here, we do have some problems bringing people to the police sometimes, not always by manipulating them to go sometimes, but it's not easy, still not easy. In Sweden, Professor Tiby has looked upon those dark and hidden numbers. What are they about? Why don't we report? Of course, if you know the perpetrator in school, your schoolmates for one example, your colleagues, are you going to report that? No. You don't even go to your boss or your teacher, you keep it for yourself. How do you perceive the helpers? Are they helping or are they actually going to hurt you? And I'm very thankful for you bringing in other countries here. Sebastian, I know that you, Bastian, sorry, you have been very much part of ILGA Europe and ILGA International in the work with hate crimes, and it looks very differently. We speak with colleagues that tell us that the police is their biggest enemy. If you go to the police, they're gonna abuse you. You know, that's a part of Europe. And we don't have to go to the Eastern Bloc. We spoke a lot about the Eastern Bloc. I've met clients from Greece. I've met clients from Italy coming to Stockholm, coming to you in Germany, I think, trying to find help because they don't dare to go to the police. They're gonna be harassed, you know. So we do have a lot of problems that the European Parliament has to deal with. Shame and fear are psychologically well-known factors. And resources. You spoke of it before, and if you live in the country, you don't have a network, and you didn't come out of the closet really, how are you going to get some help? It's hard. It's difficult. We also know that priorities in education within the police, and David, when you told us about priorities, we could see in Sweden in 2004, when the government decided on to prioritize hate crimes, that not much was done, but at least 3,000 police officers had special training. That was good. And, but we need to follow it up, of course. Another part that Professor Thibault is looking very, very deep on is how these crimes are being handled in media. There is immediate reactions within small minorities when something happens in media. And I've asked for this seminar to not be on film. The camera is not on, the sound is on. And that is actually because I have threats. All right? I don't want to be too much on pictures and actually not on a film. So that's why. I'm not afraid of it as an individual, but I'm afraid of it because I have a family. There's a reason why we're here. And I think that's important to also put down the foot and tell you that. There are threats going on all the time. And media has a big part. In Sweden, there was a nice result when we managed to tell the police and media to not put out in the papers, he was bashed because he's gay or homosexual. Instead, put out, he was condemned and bashed because somebody hated him. You put the guilt on the offender and not on the offended. And that's a big change when media starts blaming the offender instead of us. You could always say she or he, they are gay and that's why, but that's too easy. The police, they have just the numbers of people that come to them, but they have seen difficulties and possibilities, and I think that's a good way of doing this. We have to see the possibilities of how to work further. And what they saw was, and it's similar, has been in the UK, I know that you've done a lot of research on this, the police admitted we don't see these crimes if we don't especially look for them. And perhaps somebody else of you will talk a bit more about that. What is the special things surrounding these crimes? 10 years ago, the police sometimes called me and they said, is there something especially you should look at? There has been a murder in an apartment. And I was like, have you gone through his email, his work on the computer, and his mobile phone? This is normal standard nowadays. But they didn't do that 10 years ago. And there they could find people he had met the last week and the week before and find the offender usually. Stockholm also and Sweden, they put out, and they were very open about it. I think that's the way to go for the police and other authorities. They said, we have to invite the minorities if we want them to report. And I think London and probably other cities in England have made good examples of that, and you would probably tell us a bit more about that, examples from England or the UK. I met police officers in London 2008, and they told us how they took a bus and tried to recruit people to become police officers from minorities. I think that's a great idea, how they travel into the areas and said, hi, here we are, please come and talk to us, don't be afraid of us. Would you like to be trained as a police officer? And yeah, they have a lot of systems that we like in Sweden. And again, this uncertainness with the definition. You have a big task from this group to get down to the definition, because it has a lot of problems connected with it, of how we work outside the definition. How do we work together? The helpline and the police in Sweden. What do we gain from having a specialized unit in the police with hate crimes? Well, actually, the number of solved cases went from 9% to 17% in 3 years by having a specialized unit who knows what to look for when they look for these crimes. So it's a big increase. And what we could see from the victim's view was that if we have safe victims that feel safe and are protected, it meant that the police actually got the whole story. Because a lot of victims, they don't tell the whole story. Who wants to be a victim? Why should I tell anybody that I'm gay? Why? Does that have anything to do with the court? And also, because they got this big story and the whole story, they have had a much better chance to actually catch the perpetrators. And we could eventually see that they did get convicted. And there's one more factor, a lot of factors that are not included here, but there's one crucial factor, and that is to have a very qualified lawyer from the beginning at these crimes, to come with you to the police, to follow you through the whole, phrase. Because then we could see that there are much more convictions. And from my point of view, and for us within psychology, when people have a fair conviction presented to them, and they know that they were a part of it, that they were brave to go to the court, you can feel that they get their justice back, and also their self-esteem, actually. They grow a bit. and it's a lot of it's very satisfactory. So there is a lot to gain from working together, and this is also an example of that. We have to be, what's the word, interdisciplinary? Wow. Yeah, which is great. We need a lot more of that, and I think Bastian and I, who's been doing this in Europe for a very long time, we missed that part, so we're very happy that more people get involved. The field of psychology, when it comes to being gay or not being straight, I just wanted to show you some pictures, and this is not long ago. A lot of practitioners within psychology in Europe, in America, all over the world, still work from the desired and the desirable solution, which is supposed to be heterosexuality. Don't you ever forget this, because this is what our clients meet in the field. Psychologists, they still work towards this. In Sweden, this is not legal, and you can file a report, but who files reports on their therapists? Nobody. And what patients or clients feel is that it's hard and it's very difficult to feel normal there. We know from research in different countries that the LGBTQ population go for help. And that is interesting, because we also know this. But still, we go for help in a high level within psychology. And we're going to meet this, and it hurts. One of the most well-known psychoanalysts and doctors in the world, it's Etchegoyen. The literature in psychoanalysis, it's a book this thick, and you have to read it to become something like I am. And when I was studying at Karolinska Institute, which is pretty famous, I brought out 38 quotes like this from that book. I brought it to my teachers, and I told them, this is discrimination. But what was the saddest part was that in my classroom, I had 29 students who all believed that this is true. They learned this way. I will say that the preventive work concerning hate crimes and discrimination has a lot to do with the educational system, both with the small ones, but especially with us who are professionals. This is not all right. This is horrendous. If you have these thoughts, being a clinician, you're going to probably put your patient in suicidal thoughts. This is dangerous work. This is just an example. This is 2005. It's not long ago. I did my small study, or my finishing study, becoming a psychotherapist. I was thinking that I should do it on trauma and secondary trauma, but then I figured out that if anybody can interview this group was gay and bisexual young people, I could do it, because I have a trust within the community. The community, what is the community? But somehow I'm well known in Sweden, and the kids knew who I was. And I had the opportunity to meet 10 young people, half of them men, half of them women. And they were from the whole part of Sweden, which is very long, as you know. And they came from different backgrounds, totally. And I asked them about their suicidal thoughts, but I was more interested in how did you survive? What made you survive, actually? And the risk factors is nothing new. Dysfunctional and conflict families. You have that when you look upon suicide with all people, dysfunctional families and conflict families, young people don't feel all right there. More typical for the LGBT group was negative response when coming out. Norwegian research showed that the most serious and difficult time is about 6 months after coming out. The risk for suicide raises from 4 times higher than heterosexual youth not coming out to 6 times when coming out. So how are we going to handle that? Should we push the young ones in the closet and tell them to stay there? We can't do that. It's actually dangerous to come out. That's a fact. They were feeling and having experience of alienation and vulnerability, both at home and school. School is a dangerous place. And actually coming and going from school is very dangerous. I've met clients that are between 15 and 19. That's all right. Between 15 and 19. But every time they walk to school and every time they walk home from school, they do a little extra walk. And you ask them, why do you do that? Because they're waiting for me over there. And then you ask them, do they wait every day? Every day. And we like to call this bullying and so on, but I want to put on more criminal words on this. This is harassment, this is sometimes abuse and so on. But the young ones are making strategies that are not good for them, you know. We could also see when it comes to suicide, the destructive friendships, people that were themselves planning to commit suicide could bring in others in their thoughts and start planning together and making pacts. We're going to do it on Thursday at 5 o'clock. That was a big risk factor. But, again, incompetent and unprofessional, unqualified professionals was pointed out as one of the most important factors of why I don't want to stay alive. There's also another one, and we spoke a little bit about it yesterday, about identity confusion and difficulties with the identity is a risk factor. Should we make this to an individual problem? What makes people confused? I'm getting back to that. Because Sweden, we have research, but the UK, I want to address you a bit. You had a report, and it came just 2 days ago, about risk factors and health among the young ones in the LGBT group. And it showed the same numbers I'm going to show, or not numbers, but facts that I'm going to show you now. And this is a big research made in England. I think it's splendid if you want to know a bit more about how the young ones actually do cope. And they could say 3 casual explanations that stood out. Isolation was an important part of it. Homophobic reactions, again, hate crimes. But here the word homophobic reactions. That's something else, is it? Or is that a hate crime? I give it to you. I give it to them. And the family again. The family in the center the whole time. And the impact of coming out for the family. And they could actually see that these explanations actually could and might drive somebody to suicide. You know, these 3, or at least the one at the first, that's enough. Isolation. Why did I bring this material? Because it has something to do with hate crimes. we have to look upon the lives of LGBTQ people and other minorities living with hate crimes. There are circumstances we have to be aware of. And here comes the word.
If you give us the slides, I will call it resources.
Yeah, you may call it whatever you want to. But there are some protective or resilient factors, if you want to use that are more important than others. And it's called, with the international terminology today, we call it safe places. And it could actually be anything about doing sports, doing music, doing theater, being politically active, and so on. But it's a place where you can be who you are and not being an outcast or being threatened. And my informants, they told me, my young people told me that if they would not have had this, they would not have made it. So when we decrease the money for young people to have safe places to be in, we're actually, we kind of, we don't trust the young ones to take care of themselves because they actually do this. This is outside the family. They get in touch with other safe places. Some of them they were a little bit older, they told me that moving from home, yes, 5, perfect. Moving from home, becoming independent. And when you're 13, how are you supposed to move out? You can't do that. Love. I said before, the name should be love and hate instead of law and hate. Love is very important, and comfort from friends, partners, and also actually having an animal like a horse or a dog was mentioned by some. We know when we have a family that is supportive and loving, the suicide risk decreases with 50%. 50%. The family is really, really important. And other adults are very important too. In school, outside school, and other role models that you find like a neighbor or somebody else who can support you. But what differs between heterosexual youth and LGBTQ youth is that almost everybody who's LGBTQ, they talk about security, safetiness, to be safe. This is not common when you speak to heterosexual youth. And that's why the police and so on, they are very important. But how do we make people safe outside the area of the police? And being down in psychology on the individual level, we need to move forward because we know all these facts, the risk factors, the resilient factors, we know the protective factors and so on. And we need to put out about hate crimes. What are they about? Are they about? And I'm, lending it over for you, Mr. Dunbar, who's going to talk about perpetrators. But is it about perpetrators or what we call normative structures? And we all in this room know the answer, that it's about normative structures, I hope. But what is preventive work when it comes to normative structures? That is something to solve for the group here. And I'm really looking forward to those results. And I have one example from Florida, the US, when it comes to suicide, and I just wanted to bring out a very nice example. In Florida in the US, they had the most suicides among young people overall in the US. They decided on that they wanted to do something against that. They had to prevent. And what do we know about suicide? Well, it is closely connected to depression. So how do you find out that young people are depressed? who finds out? It's a little bit hard, but what did they do? They trained everybody in the school, from the cleaners to the ones taking care of the food, the teachers, everybody, in how to detect depression among young ones. They call it a wraparound system. Adults that wrap around, I love it, wrap around. And what happened? Within 3 years, the numbers from being the highest in the US became the lowest. And it took 2 weeks of training. That's nothing. 2 weeks of training. And how does it happen? Well, when the kid is coming up to get his or her food, they say, would you like some rice or potato? I'd like some rice. Okay, he gets the rice. And then the lady says, where are you between 1 and 10 today? I'm a 7. All right. You know what? I end work at 3 o'clock. I'm going to sit out here and wait for you when you stop school. And we're going to talk a little bit. The result is that everybody who's an adult in the school is now much more, happy because they can help the kids. And they're allowed to help them. And when it's sincere and when it's difficult, they tell the kid, come on now, let's go to the nursing school or the doctoring school and so on. This might sound like an utopia, but it's actually happening. And Sweden is now, within the psychiatry area, bringing in the wraparound system to the schools in Sweden in a giant level, because this is brilliant. Give people self-esteem that you can help young people and they will start helping them. It's magic. And it worked in Florida. I think it will work in many more places. Thank you very much.